The best way how to make healthcare sustainable is really kind of looking how you can improve the prevention and also early diagnosis and early treatment. Dialysis is one of the biggest impact of the emission in the healthcare sector. So if we can do anything to promote, educate and support the early diagnosis of chronic kidney disease, we will actually have a major impact on the cost burden and on the gas emission.
It's a really interesting point about dialysis being a really polluting area of healthcare, and actually by diagnosing early, by catching a disease like kidney disease early, you reduce the reliance on dialysis and therefore you reduce the carbon footprint. But I guess the least polluting area of healthcare, or the least polluting healthcare treatment, is the treatment you never give, because you've picked up early, because you've discovered a disease early and been able to lessen the reliance on that kind of polluting treatment. So, welcome to Health Beats. We are one of the world's leading international healthcare podcasts, supported by Abu Dhabi Global Healthcare Week, where we are today for the second iteration of Abu Dhabi Global Healthcare Week. My name's Steve Gardner. I'm the Managing Director of Healthcare World magazine and your host here at Health Beats. And if you haven't already subscribed to the podcast, please make sure you do so. Apple Podcasts, Spotify, wherever you get your podcasts. Trust me, you won't regret it. I'm here today at Abu Dhabi Global Healthcare Week with Iskra Reic, who is the Executive Director of International at AstraZeneca. I've got that pronunciation correct, Iskra? I've done well. It's a good start. So, really lovely to meet you. AstraZeneca, I'm sure we all know, a globally renowned pharmaceutical firm. What brings you to Abu Dhabi Global Healthcare Week, and what are the kind of topics of discussion that you're looking to pick up on this week?
Yes, and actually it's a pleasure to be here, and it's our pleasure to be here second time in a row, because we want to think that we are a strategic partner for the Abu Dhabi and the UAE government, and we really appreciate the opportunity to engage in the very important discussions in how to make healthcare sustainable and resilient for the future. And therefore, we believe that Abu Dhabi Global Health Week Conference is not really a conference only, it's almost like catalyst for change. And I appreciate the opportunity that this meeting brings together government, academia, industry, innovators to really tackle some of the most highest burden issues of how you make the healthcare really viable for the future generation. And you will see AstraZeneca involved during this week a number of important topics particularly, and those are the topics that are really in the core of what we are trying to do, and this is everything that has to do with transforming healthcare for the patients. So basically you will see us for the discussion about the health equity, and it is important discussion, especially important for this part of the world as well as for other emerging markets. And together with the UAE government, we are really trying to see what are the options to help and support broadening the access to the healthcare to the patient wherever they live. The second important topic is how we tackle the rise of the non-communicable disease, and how we think about the ways to make healthcare system future from the financing perspective per se. And then the third important topic is around the digital innovation, or how the digital innovation and the artificial intelligence can really help us in both, managing the non-communicable diseases, but also helping us expanding the access to the healthcare. And on top of all of that, we're also excited to join the discussion around the climate impact, because I will argue that climate crisis is one of the biggest healthcare crises of today.
Yeah, it's a really interesting one. I'll pick one thing on that piece in particular, because sustainability in healthcare, we probably don't talk about it enough, do we? It is one of the most polluting industries on the planet, and it isn't good enough, I think, anymore to say, oh, well, we don't count, we're not, we don't have to worry about sustainability because we're so crucial to the good of humanity. But sustainability in healthcare is massively important, and the impact of healthcare on the climate. And I know that AstraZeneca, you have some some goals, some ambitions, and some ideas about how we can make healthcare more sustainable. What do they look like?
You're absolutely right. I think it's an important topic because, as I mentioned, the climate crisis is really the biggest health crisis. I mean, if you think about that, today, 30 million people dies annually from the climate-related diseases, which is twice as high as it was pre-COVID. And when you think about it, the environmental impact is really exacerbating many non-communicable diseases. Think about the respiratory diseases, think about the cancer, the war. And therefore, I think it's really responsibility of every stakeholder in the healthcare sector to think about it. And to your point of the healthcare impact, healthcare as a sector impacts at approximately 5% of the greenhouse gas emission, which is, I would argue, a big and important impact. And everything we can do to help to decarbonise the healthcare system is an important impact that we can have. And I want to mention here, sitting here in Abu Dhabi, we have an important partnership with the UAE government to really look at the ways how to help decarbonise healthcare. Let me give you one simple example. Patients with a chronic kidney disease. Unfortunately, if you are not diagnosed and treated in the early stage of the disease, which is usually called stage 1 or 2, then you progress relatively quickly to the stages of 4 and 5. Unfortunately, the end game of that is dialysis. Dialysis is one of the biggest impact on the emission in the healthcare sector. So, if we can do anything to promote, educate and support the early diagnosis of the chronic kidney disease, we will actually have a major impact on the cost burden and on the emission.
It's a really, really interesting point about dialysis being a really polluting area of healthcare, and actually by diagnosing early, by catching a disease like kidney disease early, you reduce the reliance on dialysis and therefore you reduce the carbon footprint. But I guess the least polluting area of healthcare, or the least polluting healthcare treatment, is the treatment you never give, because you've picked up early, because you've discovered a disease early and been able to lessen the reliance on that kind of polluting treatment. And from that point of view, you understand that AstraZeneca, you're doing some work to kind of find ways of diagnosing and finding rare diseases early. How is that working? What is it you're doing in that regard?
Yeah, you're absolutely right. The best way how to make healthcare sustainable is really kind of looking how you can improve the prevention and also early diagnosis and early treatment to some extent. And this is the part of the what we like to call transforming healthcare, and really try to use primarily private-public partnership, because you cannot really change and improve healthcare system in terms of increasing its sustainability and resilience if you don't bring public and private stakeholders together. And the second is how we can partner together by using the artificial intelligence and the technology that to actually support us in doing so. For example, one of the big projects is the lung cancer screening.
Right.
And with the use of with enhanced artificial intelligence X-ray chest screening, you basically help patients to filter the high-risk nodules by the X-ray, and with the help of AI, you can actually identify the patients at risk and potentially help them to get the diagnosis and the treatment early. We have a big project called Lung Alliance, or Lung Cancer Ambition, and the UAE is also one important partner for us, really supporting the usage of that. And the second angle is education, and promoting the awareness and education both on the healthcare workers, but also the broader audience. So can we educate the patients and helping them to understand why it's important to get the diagnosis early is another segment to look at.
Because I think that's a really interesting point. And you talk there about public and private partnership. When it comes to preventative care and it comes to preventative medicine, there's always that tension, isn't there, between the insurance payer, the provider that's then providing the care. Both have different incentives. Government then sits into that agenda and drives that agenda as well. And you then, as a pharmaceutical company, what's your role there? How do you play a role in that?
Yeah, let me kind of try to simplify that, because you're right. That's how it looks like. So it looks very complicated. Let's try to simplify that. So basically today, if you look non-communicable diseases, there are 3 billion people globally that has one or multiple non-communicable diseases. Now, putting that math, the percentage of aging population. Population is aging rapidly, which means that the healthcare system burden will be absolutely unsustainable, and nobody will be able to finance it. First, there are some projections saying that the treatment of non-communicable diseases by 2030 will cost healthcare systems around the world $47 trillion US dollars. So I would argue that no matter of the different stakeholders and what are their incentives, I do believe that we all have one incentive, and that is to do everything possible to decrease that burden. And the only way how you can decrease that burden is to improve significantly on the prevention, early diagnosis, and early treatment. By doing so, you are actually decreasing the cost of the healthcare that can use that capacity and capabilities for those that really need it. And also in that way, you're increasing the equitable access, because then you're basically having the lower cost healthcare solutions that can be provided to the many people globally.
And I was going to come to that point, because you mentioned in your first answer that the point about health equity and the number of people around the world that don't have access to even basic healthcare. UN sustainability goal was complete global access to healthcare, universal health coverage by 2030. We're kind of still some way away from that as we sit here in 2025. As a major player in global pharmaceuticals, what's your agenda here? How are you assisting with that drive towards universal health coverage?
It's a very important question, and I would argue first and foremost, I think the agenda of us as innovators in the healthcare sector is really to do our best to ensure that everybody, no matter where they live, have the opportunity for living a healthier life. I think that's the starting point. Now, there are many different ways how you can do it. I think one example is, as I mentioned, is how you make the prevention and screening broadly available. I gave you an example of the lung cancer. Let me give you another example. It's a great example of private-public partnership in Africa. It's called the Cancer Care Africa program. Where basically, different stakeholders come together, basically supporting the use of the remote handheld ultrasound that can help to diagnose the breast cancer. And by doing so, you're really kind of allowing, you educate nurses to actually reach out to the women in the remote areas and help them to get a diagnosis early. The second example is a rare disease. Because if you live with a rare disease, that's kind of in its essence inequitable. Because 90% of the rare diseases do not have approved treatment. For the rare disease patient, it takes on average 4.8 years and the consultation with 7 different specialties to actually get to the diagnosis. So then how again we can build together the center of excellence to help those patients to get the diagnosis early, because by diagnosing early you are clearly improving the disease outcome. And also how you can then help the funding to be there for those who are diagnosed to actually allow them and support them to access the rare disease.
From your perspective, and you talked about this a lot during the course of this conversation, unfortunately we're running out of time. I wish we had more time to talk, because this has been a really fascinating discussion. But you talk a lot about partnerships. Is that the core of the approach? That's presenting perspective. All of this stuff around sustainability, around preventative care, around the drive towards health equity. Is this all about partnerships? What role do those partnerships play?
So partnerships are definitely important, but when it comes to sustainability, I think it's also important that each and every one of us start with your own value chain and try to decarbonize it. So for example, in AstraZeneca, they have zero carbon ambition, and we really want first and foremost to decrease significantly the greenhouse emissions from our own.
Which I guess is manufacturing as well. The manufacturing of pharmaceuticals, that's a huge.
Yeah, it's the first is we call it scope 1 and 2, it's manufacturing, operations, and the fleet.
Yeah.
And you're planning to decrease it for 98% by 2026.
Wow.
And the second part is halving the last emission across the whole value chain, and then also includes your vendors and your partners. And AstraZeneca is one of the companies that basically are the first or leading in the sustainable market initiatives that was initiated by the Kick Charles that some years ago. And I think it's really important piece that each and every player starts with its own operation. On top of that, if you really want to make the healthcare sustainable for the pure future, for the people, for the planet, and for the society, we need to have a private-public partnership. Nobody can do it on its own.
And that's a fantastic place to finish. We're being waved out from outside. We don't have any more time with you, but it's been an absolutely fantastic conversation. And I think at the end of the day, it's not just about public-private partnerships, it's a partnership between all of us. There's almost a kind of social contract that we all have to think about the way that we are looking after sustainability and the planet. It's all we got time for on this particular podcast. Thank you so much to Iskra. Another really, really interesting conversation. Don't forget to subscribe to Health Beats on Apple Podcasts, on Spotify, wherever you get your podcasts, and keep your eyes peeled. We've got so much more content coming this week from here in Abu Dhabi. Thank you for watching. Thank you.